This episode of Beauty and the Surgeon podcast is brought to you by Let's Get Checked. Let's Get Checked is an online company dedicated to making professional health testing easy and accessible. Let's Get Checked offers fast, affordable, completely confidential at-home health tests from a range of tests from STDs, male and female hormones, and even COVID-19. Listeners of our podcast who are new to Let's Get Checked get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com, trylgc.com/beauty, BEAUTY, and be sure to use the code BEAUTY20, BEAUTY20 at checkout. Do it. Getting tested is important. It's the responsible thing to do, and you know how important I think it is to make sure you understand your labs. Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner, and I'm joined today, as always, by Dr. Jason Martin. He's board-certified plastic and reconstructive surgeon. Dr. Martin, how you doing?
I'm doing pretty good, Amy. How you doing?
I'm good. I'm happy to see that you are not numb. We were concerned that you might be coming straight from the dentist and all numbed up.
With half of the side of my mouth not moving. Yep, that would be hard to do a podcast / YouTube video.
I was worried I was going to have to carry it for us, but I'm glad you are here and able to
He's like,
speak.
I don't have enough time. I'm like, perfect. Now I can go do my podcast.
Yes. So if you are new to our podcast and
do you think as the dentist, he's like looking at me like, what are you talking about?
Probably.
Aren't you a plastic surgeon? Like, why are you, what? Okay.
Yeah, he knows us though. He's
I guess.
friend of the podcast dentist.
Friend of the podcast dentist.
I don't know that he listens to podcasts.
Doubt he does.
Yeah. If you are a new listener to our podcast and you would like to be featured on our podcast as one of our listener questions, because today's episode is questions from you, the listeners.
Love it.
You can leave us a voicemail. I'm going to have Nils put that up right now. So just in case you get motivated during this podcast to leave us a voicemail, it's 303-630-9038. You can also find us on social media at Beauty and the Surgeon Podcast and at Jason Martin MD on YouTube and other social media platforms. So we do love feedback from listeners, love questions. These are some of the best episodes to do because, we don't always know what people want to know about.
Yeah.
So having, questions from listeners is a really awesome way to find out more of what you guys actually want to hear about.
And it's really interesting to see what people pick up on. That's what really gets me.
Yeah, podcasts?
Right.
Yeah,
the ones that, like, I'm going through this, I'm getting this surgery, I get those, but some of the things that people have interest in, they're picking out these little nuances in the topics that we discuss, and I love those parts.
Yeah, those are good. So our first question, let's just jump right into it. Our first question was actually a text message. You can also text that number, 303-630-9038, and this was from Patricia. She said, she actually started with Dr. Martin, is a healthy 72-year-old woman too old to have a thigh lift? I have saggy skin at the top and pockets of fat by the inside of my knees. And how do you poop when you can't sit after surgery?
Good question.
It's
a very good question.
Such good questions. I've watched all of your YouTube videos and haven't heard the answer to either. We actually did answer the pooping question on our thigh lift episode where we talked about getting the toilet extender.
Yeah, and we were going to put our logo on it and sell it nationally. That was the way that we were going to get Amy and I to extreme success.
Yeah, so the way you poop after a thigh lift is delicately.
Yeah.
Hopefully with the aid of a toilet extender. Like I really do highly recommend those. You can rent them but you can also just buy them pretty inexpensively.
And those are pretty standardized now.
Yep. They just lift the toilet seat up about 5 inches and they have handles so you don't have to completely sit to have a bowel movement. It's useful for everything. The other thing that we talk about on that episode that I highly recommend is getting, if you don't have a bidet, is getting a bidet. There's one of the ones that
By the way, we stayed at a place my son called the bidet a badass.
A badass. Feels good, right? Was that when you guys were in France?
Yes.
Was there only a bidet?
Yeah, I used to, Dad, did you see that badass? I was like, son, you're 15.
Bidet.
You don't talk about women that way. That was very funny. Yeah, bidets are really good, but most people don't have bidets.
No, but you can get little sitz baths or handheld ones. But anymore you can get like very inexpensive, like less than $100, like little attachments, like an attachment bidet. It'll only be one temperature, so it won't be like the best like French experience of having like perfume and warm water, but it's cold water and it'll clean you off really nicely.
So, or would you just have people like get in the shower, like literally after they go
Well,
poop?
if they have drains, they can't. So initially, I think that's why I really do recommend a bidet or just like wet wipes.
Let me scope in what I'm saying. Could they get in the shower with one of those handheld things and it's very localized in the area?
Yeah. So if you don't have a bidet, it's kind of a handheld.
Yeah, handheld
if you don't handheld shower. So let's answer the first part of the question. I'll leave that up to you now that I've talked about pooping.
Number one, 72 is not too old.
No.
Okay? I'm living to 100. Amy, how old are you living till?
Oh, gosh. I'd like to be like 110.
That's pretty good. Nils? Yeah. We'll see what Nils lives to. Nils, I think he's healthy. Like, he looks healthy. He looks vibrant. So I think he's like
He's
Northern
Yeah.
European. He's probably from one of those blue zones where people live to 100. I am not. I'm from Kentucky. People live to about 60. Like I got 10 years left.
Yeah, make the most of them.
Yeah, better make these 10 years work. So 72 is not too old at all for a thigh lift, for a tummy tuck, for a facelift. Now, that's with the caveat. Every decade of life, we tend to get more and more medical issues, right? So hypertension can get worse. You can develop type 2 diabetes. You can have osteoporosis, all these things that occur. And in worst case scenario, cancer is more common every decade of life that you're older. So you have to consider all those things. But making an assumption that your medical history is not a problem and you're very healthy, then you would definitely be a candidate for this. The second part of this is the recovery from a thigh lift, as you know from watching the episode, is not a walk in the park. And that could be hard for anyone, especially people in their 60s and 70s. And so that's the question. And someone who's a little older, maybe not as mobile, okay, you're not as spry on your feet, or you don't have as good a balance, then you're not going to be walking around as much, and we may put you on low molecular weight heparin, something called Lovenox, in that situation. So that would be a case-by-case basis. But you're definitely a candidate without the medical issues.
That would have been my concern too, is more mobility, just making sure that you have great mobility. I mean, we tend to have a very healthy population base here in Colorado, but we have a lot of patients who starting in their, mid to late 50s and beyond have, knee and hip replacements just because they don't want to stop doing all the things they love doing. So as long as your joints are healthy and you're able to mobilize efficiently before surgery, then you should be fine as long as everything else is equal.
So the saggy skin on the top, we can definitely take care of, most likely with a medial thigh lift. And then the pockets of fat inside your knee can be ameliorated.
I like it.
Okay. With liposuction. And you can do that in the office under local anesthesia. We use...
Not the thigh lift.
The fat around the knees.
But you
I was
do it
very
at the same time with your
descriptive
thigh
when I said ameliorated. So and that can be done in
right, but you said we could do that in the office, but it was all one sentence.
Oh,
like with the thigh lift, we could not do the thigh lift in the office.
I did put a period in there?
You did not. Like the thigh lift cannot be done in the office under any circumstances.
That's true. I mean, you could do it. That would be miserable.
It would be terrible.
The fat around your knees, the inside of your knees, can be taken care of with liposuction. We use something called Body Tight, which is adding radio frequency energy into the area of liposuction.
But we would do that at the time of surgery.
Yeah, exactly.
We wouldn't do it separately.
Right. But if for those people, we've had people come in who are thigh lift candidates, but also have fat on the knees, just choose to treat the fat on the knees to offer some improvement until they either consider a thigh lift in the future or don't do it at all. So that's something else to note. And thank you for watching our YouTube videos. Appreciate that.
Yeah. Sorry you missed the thrilling conversation where we talked about toilet
You have to go back and watch that. We had the toilet extender.
Maybe we didn't
with
talk
my
about that on the
logo
thigh lift episode. Maybe that was on like a tummy tuck
something
episode.
else.
Yeah.
That was one of our clever ideas.
To have a logo.
A Jason Martin MD certified toilet extender. And how would you say the word I just said?
Toilet.
Toilet. Okay.
Not turlet.
No, there's no R in there?
There is not.
Okay.
I think what we need on that is not just like our logo on it. You'd have to have like your face on the lid. With like some like encouraging thing to say, like, you can do it.
It has a very NASCAR feel to it.
Yeah. Right. Right? Like, you can do it.
We're here for you.
Put your back into it.
Come on, ladies. That's Amy's voice.
Yes. All right, Patricia, thank you so much for sending me
Love
a text. I would
you.
have loved a voicemail, but a text is good too.
Yeah.
So thank you so much. All right, moving on. This is our favorite. This is from blah, 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 our favorite Swedish friend.
She's from Sweden.
And I found out, blah, 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 actually emailed me directly, which was awesome, that she is a woman, because I thought you thought it was a man.
I didn't know. I was afraid to give it a pronoun. So
Yes. She's XX, so yeah, it's awesome.
Got it. She's feminine.
This actually was a question from our older podcast, but I actually brought it up because I think it's a great question. I love the way, again, like you mentioned, some of our listeners are so great at pulling things out of podcasts and really thinking deeply about them. And this is a great example of that. So I will read it. Started using sunscreen at the age of 37. Wow. Good. I'm glad you started. Since I have brown eyes, I've never worried about melanoma, but totally forgot about wrinkles. Don't we all?
And
Yeah.
she's Swedish.
Well, she probably has gorgeous skin.
I know, but it's going to get wrinkly. That's the problem.
At least she's far north. I mean, so there's a lot of darkness.
There's only
there.
sun like a half a year.
Only
Okay.
sun sometimes. Can this damage be reversed? And if so, how? Also, retinol. Would cod liver oil, on the skin be beneficial? I like the idea of not having to think about many
That's
other
like playing to the
ingredients.
crowd. That's pretty low.
in the retina products. Yes, true fan. I guess the same thing could apply for vitamin C. Buying a good ascorbic acid powder and mixing with some oil, maybe cod liver oil, and smear it on.
Yeah.
So you want to talk about the wrinkles?
Yeah. So the wrinkles for sure, especially Northern European, Western European skin, wrinkles are going to be definitive for you. That's going to happen. Now, some people are less, some people are more, and that tends to be, genetically pre-programmed, but more than likely you're going to have wrinkles, especially around the eyes and the face in comparison to someone with more melanin in their skin. The idea that you have brown eyes and that equates to not having melanoma is, I'm saying this to blah, 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 who we love dearly, is foolish. But you're right. Maybe someone who's more fair skinned, blue eyed, that kind of, I think of Amy. I was supposed to say Iris, but it's Amy. I'll get to watch the YouTube channel. Yeah, they're going to be more likely to have melanoma than not. But that doesn't, I've seen melanoma just,
in any fits.
Anecdotally speaking, on all skin types. Mm-hmm. It's so interesting that you hear these examples. It's devastating. Like Bob Marley, I think, died of melanoma. It was underneath his toenail. Mm-hmm. He's darker skinned, obviously. He's Jamaican, I think, by birth. And he had melanoma that was misdiagnosed or not diagnosed, or he didn't seek treatment. And by the time it was going to be treated, I think he was in stage 4.
Well, yeah, melanoma is like, what did they say, 4 millimeter depth?
Yeah,
it's super deadly.
Right. And so catching that melanoma early before it starts to invade the skin and then become systemic, then, that's the key to treatment. Now, I know this is a total side point, but it's crazy. The treatment for melanoma has completely changed in the past 10 years. These immunotherapies have changed the game. For example, Jimmy Carter, who was a blah, 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 who was a president in the late 70s in the United States, had stage 4 melanoma in his brain. The guy's still alive. And this, I think, was like 4 years ago or 5 years ago. Again, I have COVID brain, so I don't know time. And that's all these immunomodulators. And that never would have happened.
I think we need a disclaimer. Dr. Martin does not have COVID.
What?
You do not have COVID.
No, COVID.
Yeah. You have time warp. You don't have COVID brain, because that is a thing from people who've had COVID.
I have not had COVID.
Yeah, he has not.
I literally have not had COVID.
Yeah, neither have I.
That's another thing we need to talk about.
Yeah.
Have you had COVID?
Nope.
Nope, neither have I. And I actually sent.
That's 3 people.
I sent the rest of our office staff an article that was on NPR this week talking about this.
Do you think we're just better people than the other people that had COVID?
So it was really interesting, though. They talked about people who have high exposure, so healthcare workers, as such as you and I. You've also had children at home with it. Our medical assistant's husband had it. Like documented exposures, like multiple documented exposures. And they tried to kind of do the same thing they did with HIV research, where they found the people who were like immune to HIV and like why that was. It's actually not the same way in a cell for COVID, because COVID uses the ACE2 receptor, and without ACE2 you die. So that's not it. It doesn't work in the same way, whereas the people with HIV they lack the enzyme to allow the molecule to attach to the cell.
Sure.
It's not like that with COVID. So we're just all freaks. They don't know why.
Yeah. Well, I told you I had all those tests, and one of the tests they had was the antibody titer for COVID, and mine was extremely high. And this is a year after getting, or 6 months, 8 months after, whenever I got my last booster.
It was like January, yeah. So it's
January,
9 months.
9 months.
Yeah.
And that was really interesting to me too, because that shouldn't be so high. That should only be high for about 3 months. Like the data shows. So maybe we're also people who have been boosted that have a more formal kind of immune response that lasts longer. That's possible.
Yep. Yeah. That is the theory, actually, is that they feel like there are people whose immune systems just learn quicker.
Right. Everyone in our office got immunized early, and then Nils doesn't do anything. He never sees anyone besides his wife.
But you got Moderna, right?
I got one of each.
Oh.
My boosters were,
Maybe it was your cocktail.
I
cocktail.
get the cocktail.
Yeah.
All right.
But that's what they came to, the kind of the conclusion, at least their working conclusion right now, is that perhaps people who have not gotten active COVID infection and have documented have never had a case of COVID are just really efficient at fighting it. And again, why is that?
We're like COVID ninjas.
And it's the University of Colorado is actually doing a larger study on this. And I actually participated in the Aura study for COVID. So I know I've not had COVID, because not only was I testing weekly for us.
Because Aura tracks your temperature. And
they also made me test also. And man, the test they sent me was so crazy. Like, it was this big wheel, and I had to literally drop blood onto every single thing all the way around it and send it in a bunch of times and do like weekly surveys. Like, it was pretty involved.
That's kind of nuts.
So way off topic, blah, blah, blah. Sorry, I know it's not what you were getting at
she
here.
Likes it, though.
Yeah.
All right, so
Dr. Martin does not have COVID. That was the end of that sentence. Yeah.
Wrinkles are definitely in your future. Blah blah blah. Assuming you are Swedish, you never know. Okay, So can this damage be reversed? The sun damage is pretty difficult to reverse. Now, you can do skincare, which is maintenance. You can do treatments, which can reverse some of the sun damage effects, like lasers and radio frequency treatments. And you can use actually retinol or Retin-A. So retinol, I use a retinol, and that's why Amy was saying that my skin looks better. And that does reverse some of these problems. It'll reverse sun-damaged areas so they don't become skin cancer. It will encourage turnover of your skin. We have a whole episode on this. I don't remember the one. Skin, something with skin. Come on.
We've done a couple about skincare.
Yeah, well, anyways, we talked about all this stuff.
Skincare 101?
Skincare 101. Thank you. So, and the retinols will encourage that skin turnover, which will technically cause like remodeling of your skin and reverse some of those sun damage changes. So I think a retinol would be amazing. Cod liver oil, I think, is just playing to the crowd. You're only playing to Amy. I do not appreciate that. But obviously, I'll let Amy chime in there. And, going to other products from retinols like vitamin C's, like all these things are very helpful. So, Amy, why don't you give your opinion on the cod liver oil?
So I would highly recommend cod liver oil internally. There are definitely substances that your body needs to make the building blocks and things it can absorb through the skin. Now, can it absorb anything through the skin? Yes, our skin is highly, it's a great transdermal, solution to have things penetrate through the skin. Birth control, a lot of things, nicotine. I mean, a lot of things can be absorbed through our skin, but does that mean they're actually affecting the skin or are they just being transferred through it? With cod liver oil, you're going to get more benefit by taking it internally because, yes, it does have a powerful effect on like fighting free radicals, but the molecule size is such that I don't think it's going to be all that beneficial to apply it directly to the skin. You're better to kind of get the inside out with
the oil would be helpful because it would be hydrating.
It would be hydrating, yeah. And it would. I mean, is that where you're going to get the most benefit from it? Probably not. I think you're going to get more benefit from it by actually using it internally to help fight that free radical damage. Vitamin C is different. So vitamin C, I actually do think should be applied topically in addition to being taken orally. As we talked a lot about with vitamin C, it's a water-soluble vitamin and it has a very short half-life. It's also very unstable.
And it doesn't like sunlight per memory, right?
That is correct. And that's why it should always be kept in a completely airtight. And
I love the fact that Dill's just shaking his head.
He knows.
The least cosmetic guy in this town. Like you already know all this stuff.
Yeah. And should usually be kept in a refrigerated environment. So having vitamin C, you need to make sure that it is, again, the right molecule size to be absorbed and the right pH. And that's where I wouldn't mix it with something ever because it's going to alter the pH, specifically like an oil or something that was really occlusive, because you're going to alter the pH and then you're probably not going to get the benefit. So vitamin C is typically in a very liquid form, a very thin serum that's going to be very easily absorbed to the skin. And I wouldn't.
And the bottles usually are brown, like a brown glass,
or occlusive plastic.
Plastic, yeah.
And they should be preferably like an airtight pump, an airless pump is what I would do because,
I think that's
again,
what you go, the image system has the vitamin C in it.
And it's an airless pump.
Yeah. So that Amy got me an image system that has retinol, has like a serum cream, it has vitamin C, and it has like the best facial cleanser.
And sunscreen.
It has like a very orange, a citrus kind of smell. And it's a little bit tingly. And you put it on, you feel like, oh my God, you just had a facial or something like that. Yeah. So, but I mean, that's what I do. And I do that every night. It's made a big difference in my skin quality.
Yeah.
So
vitamin C is amazing. But when you're looking for a vitamin C product, I wouldn't suggest mixing it yourself because, again, you're not, unless you're using pH strips to make sure that your pH is correct and that also that the powder is extremely, extremely finely milled, that you're actually going to be getting the benefit from it. So take your cod liver oil. You guys take your cod liver oil and get a good high quality vitamin C serum. And that's your minimal right there. Retinols, you can get a very pure vitamin A cream, like just a straight up Retin-A with very few additives. They also do compounded versions that are compounded in more easy to tolerate formats. But I get not wanting to put a ton of stuff on your skin.
So per memory, like the Retin-A is the definitive form that causes the effect. Retinol has to go through a conversion to get to that.
Yep. That's why it's more gentle.
It's more gentle to your skin, especially someone who's Northern European would probably be more irritated if you did a full-on Retin-A, which is why I don't do it. But you're still getting a good effect. And it's really more about a cumulative effect as opposed to this one like massive amount on your face.
Slather a bunch of retinol on and peel like crazy.
The last thing is, at some point we should just do an episode on this, is like the skin treatments for someone with your skin type. These radio frequency devices and these lasers and stuff.
We can touch on that in Skincare 101.
Yeah, there's so many different things, you get so many cool things out. There's things now that I think it was at the Halo that does a laser and radio frequency. So, and that's going to be in your future, blah, blah, blah. You're 37, if maybe you're not 37, start using at 37. So say you're in your 40s, you may consider some of these. And I need it. So I'm 49. I need some lasering. Amy's perfect.
Amy needs lasering too.
Is untreatable. He's it's terminal, so we can't treat Nils' skin.
Like IPL is actually a great option.
IPL
like for sun damage specifically. Like that's actually what
spots.
That's what I need.
And that's what you would start with. Everyone who's more kind of lighter skin color, Caucasian, would need an IPL.
It just draws out that pigment. So it's not something you want. And none of these things are a one and done. And that's the thing with skincare, whether it's external treatments or topical treatments or even the food you're eating. There's no one, it's not like you eat one thing or one, acai berry and you have perfect skin. Like these are all things that just add up, to make your aging the best it can possibly be. So a combination of using good quality topicals, having a healthy, well-prepared diet, and then, adding in some more technology-based treatments as needed and desired.
Sounds good.
I think. Yay. All right. Let's take a quick break. We'll be back for more.
Let's go.
Dr. Martin, I'm super excited to talk about our sponsor for this podcast, Let's Get Checked. If you've been a listener of our podcast, you know that we have never had a sponsor before, and that's because we're an educational podcast. We're not looking to monetize, and we also would never recommend something that we didn't believe in and or use ourselves.
So basically you're saying we're very choosy.
We're very choosy when we come to our testing, but Let's Get Checked really aligns with our values. We talk a lot about monitoring your blood values of certain things. We talked recently about vitamin D serum levels. We talk a lot about hormone levels, and it's hard for some people to get to a lab, or you're afraid of the blood draw, or just, you're concerned about confidentiality. Like you have a lot of concerns and you just don't do it. Let's Get Checked makes it super easy because it's completely confidential. You do it from your home. So there's really no excuse not to do it.
Yeah, and we did it recently. Both Amy and I did it. She looked at her women's health, basically her hormone levels, and I looked at mine on the men's health side with testosterone. It was very simple. You go online. Their online interface is really easy to use and good. We got the testing kit very quickly. And the test itself, actually doing the stick, you do a stick on the end of your finger, is not hard to do. It only took about 3 to 4 minutes. You put it back in a sealed envelope that's confidential, goes back to them. You get your results in 2 to 5 days. It's really that simple. And the best part is it's about empowerment, about you taking control and trying to do things that are positive for your health and life. And this is one way to do it, literally from the comfort of your own home.
Yeah, so they offer a wide range of tests. So they do men's and women's hormone panels. They do a full panel of STD testing. They also are now offering a COVID-19 test at home. So there are a lot of other just basic blood levels that you can get tested as well. And one of the things that we always say is you can't track what you don't check. So you might not know what's normal for you in the future if you're not checking it now, especially as it relates to hormones. And men's health specifically, I feel like is a little bit undertreated. I mean, sperm counts are dropping by a large percentage in men these days. Most men struggle at some point in their lifetime with low testosterone.
And those men do not know what the symptoms of low testosterone are. Depression, anxiety, sleep problems, osteopenia or loss of bone, loss of muscle, and something we treat all the time, gynecomastia or male breast growth. These are real problems that can be improved or treated with testosterone. And these men do not know their levels. It's so easy to get checked. And this is why we're so excited about the sponsor.
Yeah. And Let's Get Checked is a completely CLIA certified lab, the CLIA lab. So they're a well-established, completely safe lab to use. You do get contacted after, so you get your results. I got a text at 4:30 in the morning, which I loved, that my results were ready.
And we're both up at 4:30, so that was good.
Super excited. And you have access to not only a nurse, but also a physician. So a physician does review your results, and it gives you a little breakdown of like where you're sitting on those levels. Dr. Martin's had even comparisons of like where 2 of the levels should be in relation to each other, which is a really important thing to note.
Right.
Just being within the normal range is not always enough. So it really gave more information than that. You'd still want to, of course, reach out to your own doctor if you needed some additional assistance with these labs or you did see something that was concerning. We didn't, thankfully, so that was good.
Yeah. We were both good. This podcast is about empowerment. It's educational. In my private practice, I'm a board certified plastic surgeon. We are all about empowerment, and this is one way to do it. So we're very excited about the sponsorship, and we're looking forward to using it for our patients moving forward.
Yeah. So as a listener of our podcast, if you're also a new time user to Let's Get Checked, which a lot of you probably are, we do have a 20% discount code. So you do need to go to our specific URL, and it is linked in the description box below, but it's going to be TRYLGC, so LGC, like let's get checked.com/beauty, BEAUTY. And you'll need to use the code BEAUTY20 at checkout. Beauty again is BEAUTY 220. And you can pick a test, like any test you'd like, put in our code and get your test shipped to you. Getting tested is the right thing to do. It's lets you know where you're at and what's responsible.
All right. Well, let's get tested.
Let's get tested. Let's get checked.
Let's get checked.
And we're back. If you guys haven't tried Let's Get Checked, I highly recommend it. They've actually added some new tests, and when you compare them, I know there are a lot of other companies on the market now who do home testing, and like Everlywell and a couple of these others. I actually compared specifically like test to test, like what's included in some of the bigger testing packages, and I was very impressed with what Let's Get Checked.
Yeah,
tests.
and the pricing too.
Pricing is also awesome, especially with our 20% discount. So get yourself checked.
Do it.
All right. So this was a great question. This is from David. This was on YouTube. Thank you for the video, doctor. This was on our direct neck excision. I should preface that so you know what he's talking about. So what's the general feeling about scarring? Are there additional treatments involved to reduce or eliminate scarring? Thank you for any info you can provide. So remember, direct excision neck lift is typically done on men, but it's an incision right in the midline of the neck to get rid of that turkey waddle, which you don't have. So I can't show it on you. I could probably show it on me better than you. Just gets rid of this stuff in the middle.
You have none of it. Yeah. And so it's a specialty surgery. We do it in the office. It takes 45 minutes. You can go on our Instagram. I have a post, like a 60-second post.
YouTube video.
We have a YouTube. Go on our YouTube. Actually, go on our YouTube, Jason Martin, MD.
We show pictures.
We have a video in there. It's basically it's 45 minutes, but it's a 60-second video. It's really short. So you can see everything we do, and you can see the before and after. It's pretty amazing. The last one we did, I did it on the guy. He was a very nice guy, and he walks out of the room, and the wife looks at me, and she goes, "This is a miracle." And like literally, this is right after surgery. He walked out. He didn't feel a thing besides injecting the local anesthesia. And she's like, "This is absolutely amazing." And I was like, "Oh, stop the press a little bit. It's not that amazing. It's a 45-minute procedure, but it is. It's like a little magic trick." But everything has its cost, and the cost with a direct excision neck lift is a scar. So Amy, again, just kind of, I know this is repeating ourselves. There is an episode on direct excision neck lift, which by the way has had a lot of views. So it's been more surprisingly popular. What, an episode on this podcast about direct excision neck lift. Amy, so how would you describe the scar and the after in the healing and et cetera, et cetera?
Yeah, so I would say first off that the general feeling about the scarring from patients is universally positive. We've never had a patient who had an issue with their scarring.
We've never done a revision of the scar.
No, we've extended it a little.
Yeah.
We've never revised one.
We've never revised one. We've made it longer because you want it more out, more inferiorly or at the base of the neck, which I don't like to. But FYI, these are like inside baseball stuff, but I don't like to go like past the neck onto the chest. It's just because if you're wearing, you can actually see that, but he didn't care. He just wanted it all gone. So, sorry, go ahead.
Yeah, so it is a scar that you would think in theory, like when you hear it, like wow, there's gonna be a scar like straight down the front of my neck. That's gonna be terrible, but it is not. It heals extremely well. Men have the benefit of having, and this is typically a surgery done on men. Typically, it can be done on women, but it's more commonly done on men. You can't shave your neck for a week or two after surgery, so you get kind of, you get some real good scruff going. So during the recovery process, no one really can tell because you got a beard growing over it. After that, you do have to be kind of careful about shaving around the scar because it is a little bit elevated.
So we showed it before and after. One of the comments was, "Why is the scar red?" And it was literally like right after surgery, and because that was the first time he shaved, and he shaved literally right over the scar, even though we told him not to. Yeah. And it still looked pretty darn good. Yeah.
And the scar is red at first. There definitely is some pinkish or reddishness to the scar right in the center of your neck. If you're self-conscious about that, keeping a beard growing for a few weeks after surgery can definitely help minimize that. Once the scar is healed, and really by the end of the first 3 months, I would say it's pretty much invisible to anyone who's looking at you. And mostly because when we look at people, if someone is not like, they're not walking around with their neck extended like this, or looking under you,
right?
Most of the time we're talking.
Like if you're talking to someone and all of a sudden their head starts floating down,
right in there,
and tilted up, then that would be weird.
Yeah.
Like why do you want to look at my hyoid bone?
Yeah. So it's definitely in an area that, as much as it seems like it might be super visible, it really isn't when you're actually seeing people.
I know you kind of have to take our word for it, and this podcast is about honesty and real information. So just so you know, it's really not a problem. And I think the way I explain it to people when they have that concern, which is completely reasonable, is that think about how many people get thyroid surgeries
Or
and
spinal surgeries.
parathyroid surgeries and spinal surgeries. It's a lot of people, and you don't see a lot of people walking around with bad scars in their neck. The neck just heals really well.
And those are deep scars, which
and those
tend
are
to heal
scars
as
done
well.
by people that don't care about the scars.
Yeah.
Right? You're not talking about a plastic surgeon who's closing this perfectly, board certified plastic surgeon, doing
No
it correctly.
tension.
And then afterwards, if you do have a scar issue, which we don't have, you can laser those scars. You can IPL the scars. There's deep needling, radio frequency treatments. I mean, there's like tons of things that will make that scar look a lot better. If you had to, I guess in rare cases, you could inject steroids.
You could tattoo over it. I mean, there's a lot of options if you
You could
really
grow
were-
a beard.
Yeah.
So there's so many different things, but it's just not a problem with this surgery. And I think the reason is, and I've wondered, is for someone that does this all the time, it's like, why are some of these scars so good and other ones can be a little bit problematic sometimes?
You mean just like scars on the body?
In general.
Yeah.
Number one, the neck heals really well. And secondly, this is a fairly atraumatic procedure.
And
So
there's very little tension on it
there's
too.
minimal tension. You're just kind of, if you do it, and you have to do it correctly. And that's the other part. Like you got to go to someone, and not many people do this surgery, but when you close it, it has to be perfectly closed without tension. So it's just enough towards almost tension, but it's like that a millimeter, kind of getting that closed. And that's what I do really well. And the patients tend to heal really well from the surgery. So if you're thinking about it, I mean,
Yeah, go see it before and afters. I think the biggest piece of advice I could give you or anyone who is having this procedure to reduce your scar is to keep it out of the sun and wear sunscreen. We've talked a lot about scarring on our many podcasts, but specifically on our, there's that word again, on our podcast about scarring. When your scar is being hit or your skin is being hit by UV rays, your body is fighting really hard to fight that free radical damage or to fight those UV rays. So it stops working on the scar. So the more you can protect that scar from needing to like kind of fight for its life a little bit, from like being radiated by the sun, the better it's going to heal, the less pigment it's going to have, just the better your scar is going to look. I think, Dr. Martin, you really hit on something really powerful in talking about why this scar heals so well. You think about the pull on this is toward the midline. There's really no tension on it because it's done well, but also there's nothing pulling it back. Whereas with like a facelift even, we pull up and there's everything else wanting to pull it down.
Right.
With this, there's really nothing.
You're not going up against gravity. You're kind of pulling toward a midline.
Yep.
It has a totally different force vector than a neck lift. And you definitely do not have to pull as tight. Now, long term, you're going to have loosening there. That's inevitable. And so long term, what's more durable, a direct excision neck lift or a neck lift alone? That's person dependent.
It is. I think it so much depends on the facial structure.
Yeah. Men have better jaw lines. They usually have better cheek or neck definition. If you have some fat there, I can do some liposuction at the same time. So, it's one of my favorite surgeries to do. It's 45 minutes. You walk in and walk out.
Quick.
The people come in a week later. They have literally no pain. It's crazy. And as the wife said, it's miraculous.
It really
literally
kind of
right in front of
is.
your eyes, everything changes.
Yeah. We've had so many examples we could tell you. The patients we've done this procedure on, like one who was, reuniting with a past love and like was wanting to look, really good for it. And it was like a month
How
after
do I
surgery.
not know any of these stories?
Because you don't get into it with these people like I do.
But I want to. Why do people not tell me stuff?
Because you're just in and out.
Okay.
They're just telling you how good you are.
All right.
They're waiting until you leave. To
I
tell
don't
me
need that anymore. I know I'm good. I
Yeah.
just need the stories. I want to know about the love and how did that go with the
Right?
with
I
the
do
lady
wonder
from
how
high
it went.
school.
Yeah. So, but a month later felt perfectly confident seeing someone they had not seen in a very long time that their scar was not visible. Another patient who was literally back in court a week later in front of a jury, was a trial attorney. So it's not, we can say it over and over, and I know it's hard to believe us, but if you are considering it, I would highly
Let's put it
recommend.
this way. We're not trying to sell you on it,
Yeah.
David.
No, but
you
it's,
don't have to come to me.
Yeah.
You can take my
It's
word
a
for it or
great
not.
surgery.
It's an amazing surgery, but it's only for the right person.
Yeah.
And the scar ultimately, and with bright light looking directly at it, will be visible. Faint, but visible.
Yeah. What would somebody know what it was from though? No. No one's
Yeah.
going to look at this. They're going to think you had a neck surgery,
Right.
not a cosmetic neck surgery.
I do this for a living, and everyone has, so many people have
Yeah.
necks on their scars on their neck, and I never ever think, what was that scar from?
Right. What was
I
that
just
from a
kinda
direct excision
overlook
neck
it.
lift? Yeah.
So if they had it on the face, that would be a different
Yes.
story, but the neck is not something you look at. You're so right.
Yeah. So,
All right.
all right. Thank you so much, David. I hope that helps. Sunscreen. Keep it out of the sun. All right. This is from Suzette. This was a really good question about this. I think she actually, no, this was left on the one about brow lifts. I thought maybe there was one on the one about Botox, but that wasn't this one. Suzette says, have you ever done the blepharoplasty first and decided not to go ahead with the brow lift?
This is kind of like a board question, you know?
Right. If you have the patient consented and prepped for both.
It's like an ethical question. So you've done the blepharoplasty and you realize that you were too aggressive or something. Do you still do the brow lift because the patient paid for it? Like, no, absolutely not. I have not done that because I am very much into planning and
well, we usually do the brow first.
very detailed. But I've done blepharoplasties first and then brow lifts. I've done it both ways. But it's always very calculated for me, and the way I do it, it would be hard to overdo one or the other. So I always leave myself wiggle room when I'm doing those combo cases. But clearly, if you did the blepharoplasty and you felt like that was enough, that's totally fine. You don't do the brow lift. And I guess the second question is probably more appropriate, is have you ever not done procedures when they were planned? 100%. Like if I've done something like a breast augmentation and I don't think they need a lift, I will not do any kind of lift. I usually have that conversation beforehand so the patients aren't surprised. You know, they paid for it, they expected it, and then obviously we don't do it, and you take care of it afterwards. But I've not had a situation where I've done the blepharoplasty and I was like, oh man, I can't do the brow lift now.
Right.
Because I probably wouldn't have been in that situation. And those kind of situations where it's really on that threshold area, kind of on Cliff's edge, I'll just only do the blepharoplasty and tell them we can do the brow lift later on.
Yeah. And I think that too, this is where I think people have some misconceptions about what, plastic surgery in general. Like you're never pulling you should not be ever pulling so hard on a brow or taking so much skin from an eyelid that you could leave the patient with some type of like deformity or inability to close their eye. Mm-hmm. So, do I think that many surgeons would find themselves in this position? Probably not if you're going to a board certified plastic surgeon who has experience with these procedures. Like the point of doing a brow lift is not to like lift your eyelid so high. And the point of having an eyelid lift is not to raise the position of your brow. So they can be done at the same time effectively for each thing because they're treating a different area.
So brow lifts treat droopy brows. Mm-hmm. Okay, we call it brow ptosis. Why are you doing that to me? This is so annoying.
You did to me?
That is so annoying. Because I need a brow lift. Okay. So men usually have heavy brows. Amy, if you're listening, Amy, just grab my brow and pushed it in lift. A superior or up direction. Yep. So, but brow lifts lift the brows, and blepharoplasties take the excess skin out and sometimes fat from your upper eyelid. Those surgeries do not do the same thing. So that's where people get confused. Now, sometimes we'll do them together. Why? Because sometimes people have heavy upper eyelids because of the heaviness of the brow weighing down on the eyelid itself. Sometimes people have a heavy upper eyelids just from excess skin and fat in that area. And sometimes people will have a little bit of both. And we have a good brow lift episode, don't we? Do we have an episode?
We do. That's where this came from.
Great. So we have a great brow lift episode. You can go back and watch and you can see how we decide where that brow should be. And it's different for men and women too. So I may not technically need a brow lift because I'm a man.
I would say you don't need a brow lift.
In your face.
Yeah. So. I could use a brow lift, mostly just because I think all like, oh my gosh, once you realize like what that does and you like look at yourself in the mirror.
I know,
like,
I do it.
Like,
Nils doesn't do it.
So nice.
Nils has
so
a
nice,
Cro-Magnon
so subtle.
brow.
Oh.
He's like Bert, it just goes straight across.
Pulls those little edges up.
There's no arching.
It's the sun visor. Yeah. So that is a great question,
really
though, Susan.
Tearing up Nils today. I feel bad. He's a friend and he's good looking.
Yeah. So Suzette, like Dr. Barton explained, they kind of treat different areas, but if your surgeon really felt that time of surgery, even if you were consented and they went ahead with a procedure that they didn't think you needed, I mean, that's a conversation that you guys will have after surgery.
Right.
And hopefully before. I mean, there are definitely times when somebody comes in
I hope that the question was intended to say, in this situation, would you not do the brow lift? And that's absolutely no. I mean, I wouldn't do the brow lift. And that's okay. And that's why you need to go to someone who's confident will do the right thing. And I've had consented procedures I have not done because after I did the first step of it, I didn't think they needed the second step.
Yeah. Or something else.
And that was perfectly fine.
Whatever.
And the patients were very, happy that I did that.
Yeah. So it does happen. All right. Great question. All right. This is our final question. This is also from blah, blah, blah. And this question, she actually emailed me directly. And I love this question for so many reasons because it hits on so many areas that like both Dr. Martin and I are very passionate about, but also have a lot of knowledge in. So I'm going to read it. It's a little bit of a longer one, so hang in there. Here it comes. I listened carefully to your episode on...
if you had a British accent when you read this, would be better because I feel like the British accent at the beginning of the movie, kind of like Lord of the Rings. Go ahead.
I don't. And if I tried, it would just probably come off really offensive. So
It would be terrible.
I'm not going to try.
Okay.
I mean, despite that I say homeostasis in a way that makes you think that I am British.
It's weird.
I actually practice that with this. So I'm like,
No, but
hemostasis.
hemo, but you said hemio.
I know,
which
and
is,
it just
it's just
does.
very odd.
It's like the Brits. So
right, sorry.
hemostasis. I listened carefully to your episode on fat transfer to the breast. What do you make of the use of stem cells enriched for 3 weeks, so not just the ones that naturally follow, and or PRP to increase viability of the transplanted fat? I also read somewhere that fasting for 24 to 36 hours before surgery increases survival rate, actually through stem cell activation / augmentation. Supplementation with berberine both before and after surgery would have a smaller but similar effect. Have you tried any of this in your clinic? I guess the difficult thing would be to know what would have been the result if you didn't use it. And
Right.
that gets to the crux of all the issues in plastic surgery.
Yes. Blah,
In
blah,
either case, curious
blah.
if you know anything more about this.
Yeah, no, like the main problem in all of plastic surgery is doing double-blinded studies on human beings when you're like interacting with their bodies is pretty much impossible in ethical kind of civilization. So
I mean, there have been studies of using like a specific technology, like the
Right.
body type studies on the arms. They
No.
just do regular lipo
and
versus
also
body
there's
type.
bench research that use rodents and monkeys and all this kind of stuff. So and that have really important contributions, not just to plastic surgery, but to a lot of degenerative diseases like Parkinson's disease and spinal cord injuries and stuff like that. So first and foremost, I'm so interested in stem cells and fat transfer. But we have to be very clear in the United States, blah, blah, blah. The FDA is not cool with us taking something out from your body and messing with it and putting it back in.
Yeah, specifically like the enriched stem cells.
Yeah.
I mean, there are some doctors that will add like, that's the PRP, or add like exosomes. Also,
Which I think might be okay. So the point is
yeah, it's
to
very
take
borderline.
fat out, okay, or bone or whatever, and to isolate stem cells, purify it. So it's some process in a lab, okay, or in the office lab, and then re-inject that back in. It's my understanding that right now we can't do that in the United States with the FDA. So people that do stem cells literally go outside the United States. And
They might have them extracted here in the
they'll
States.
take the fat out or the bone out and they'll send it to Mexico in most places, most times. Some people go to India, some people go to Russia, and then they'll separate out the stem cells and then do whatever they're going to do with it. Re-inject it into their blood. So supposedly it has longevity and health benefits.
P shot, the G shot.
Yeah, all these different things. So right now in the United States, we take fat out from your belly and we'll inject it into your breasts. That fat actually does have stem cells in it. So technically you're taking stem cells from one place and putting it in another. But that's what we've been doing for a long time. Fat grafting has been around since probably the 70s or 60s. So that's not novel in any way. But there are other countries, and they actually look at the research. Korea was one of them. I remember we did this episode on augmentation to the breast without breast implants. I think it was Korea where they talked about the stem cell augmentation. So there are definitely like probably European countries and Asian countries that really are doing this in private practices and selling it. With that said, the data on it is pretty poor, and I looked at some of these studies and they were terrible. So I'm not really sure that stem cells are going to make that big of a difference for a fat grafting procedure per se. And secondly, what are you trying to get out of that? To have more fat grow in these areas? Do you want more fat to grow? This kind of stuff. In reality, if I was going to inject fillers into your face, I don't want it to all of a sudden double in size after I inject it. So the idea that you're contouring something with a set amount of volume, you don't want that volume to increase. And that's why it's really problematic for people to gain weight after fat transfer, because it can distort the area that was augmented, which I guess in the breast might be okay, but in like areas like the face, it's terrible, in the butt too. So very interesting. I do think PRP is useful. I do think stem cells are interesting. I don't think that the jury has decided on the benefit of those. PRP is definitely something we can do in the United States. I believe you can add PRP to fat grafting. I'm pretty sure about that, but don't quote me on it. And that has theoretically some benefits, but I've looked at the ortho literature on that, and it's kind of mixed also.
It's very patient dependent.
It's very patient dependent. So I think we don't really have a full answer yet, but we're getting there. I do think the FDA will at some point be okay with fat grafting or be okay with doing stem cell work. Not for cosmetic reasons, but it'll be the byproduct of them improving stem cells for Parkinson's or for
spinal cord injuries,
Alzheimer's, and all these different things, to where we would
reactivate the stem cells.
Yeah, reactivate or isolate and reactivate or reprogram or whatever crazy science they're doing, and utilize it for the benefit of patients that really are suffering from a definitive pathology. Amy, what about supplementation with berberine?
So the berberine one is an interesting one. That's not something I had specifically heard about. We recommend berberine for many reasons. Berberine is a powerful blood sugar regulator, as powerful as metformin in clinical studies. So it's very good at regulating blood sugar. For that reason, do I think it would be beneficial for someone around the time of surgery? Absolutely. You do have to be careful with berberine because it does have a powerful effect on the gut as well. So I wouldn't recommend starting it right before surgery if you've never taken it before, as I would not with any supplement. Like, you want to make sure you know how your body's going to respond to supplements before you take them, specifically around surgery.
Can I say something funny about berberine?
Yes.
If you gave me, and you know all this stuff and I don't, if you gave me a multiple choice test and berberine was on it, I would pick it every time. I feel like berberine's the answer to any issue that you have.
It's pretty powerful.
No, I feel like no matter what I bring up, berberine is in the equation at some point. With you, I'm talking about.
It's also called Oregon grape sometimes.
Of course it is.
Yep. So berberine, I do like, and I think that there would be some benefit of supplementing with berberine around the time of surgery, specifically if you're wanting to keep your blood sugar regulated. For the same reason, I'm very intrigued by the fasting. And we've talked a lot about.
So interesting she asked this question.
Yeah, supplementation around surgery. And I've specifically said that, around the time of surgery for most people for cosmetic procedures is not necessarily the time to fast. However, there is absolutely benefit to fasting around the time of surgery or the time of medical procedures. I actually just sent Dr. Martin an article that was published about 20 or 30 days ago about triple negative breast cancers and the benefits of using fasting prior to immunotherapy. And it actually makes the body start to respond to immunotherapy when it was very resistant to them before. Now, this is in mice models, but they are using it in human models. But with fat transfer, I think it would definitely, I could see why someone would do that, because you're basically priming all of your cells to be very healthy, and also very much it upregulates your kind of body's own natural stem cell processing. You would have to fast for long enough, though, that you got past that kind of point of autophagy, where that for most people, that's probably going to be at least 36 hours, depending on how fed a person was prior. So that's, again, something I would not recommend for someone to do the first time right around a medical procedure ever. I think you need to understand, at least go through 4 or 5 cycles of fasting to understand how your body responds and to understand how you feel, because you don't want to do something right around the time of surgery that's going to make you feel terrible, or that's going to cause you to be lightheaded or pass out or have other medical issues or
stress your body, have stress hormones going, and then you're doing a surgery. One of the things that Amy has talked about, which we presented on here, was a fasting mimicking diet.
Yep.
And that maybe that's kind of the angle that you would go, because you would still get some nutrients. You'd be focusing on hydration. And those are really focused on not elevating those stress hormones,
really regulating blood sugar.
Yeah, and kind of keeping your blood sugar and insulin levels at like an appropriate level. And those are the kind of things. It's a very interesting question. I do think with fat transfer, though, no matter what, blah, blah, blah. If you go on the internet, I'm sure the internet's the same in Sweden as it is in the United States. You can go on all these
That's
websites.
why it's called the World Wide Web.
The internets. If you go on the Googles, as George Bush said, you're going to see all these people saying all this crap, and a lot of it's just BS. I do stem cell fat transfer and all this kind of stuff, and that's really for marketing purposes. There's really no full, coherent study that really lays it out in terms of fat transfer and viability, and that's because there's so many factors that are at play here that stem cells probably are beneficial, but then so is injecting fat into an area that hasn't been radiated. So is injecting fat into someone who doesn't smoke or has good physiology or has good blood supply, don't have obesity, don't have hypertension. So it's that same old medical problem, right? Everyone wants to focus on this super isolated thing that they supposedly is going to change everything, but that's not the case, because medicine is multifactorial. So many things can affect a fat graft living or dying. Mm-hmm. I mean, in Colorado, I'm sure the same as in Sweden, people here are so skinny, and both from lifestyle and genetics, it doesn't matter. You can graft as much fat as you want. Their body's going to metabolize it all up, because that's what their body does. Mm-hmm. they're not going to hold on to the fat, for whatever reason. So, yeah, I think we're in the nascency of stem cells, nascency of using fat grafting in a way that really is effective. It's definitely where my interest is. We got a new device, BeautyFill. That's why we got the device, because I'm really interested in where this is going with volume enhancement, fat grafting, possibly stem cells, longevity.
Well, and rejuvenation.
But we're just in the nascency. So I think in the next 5 to 10 years, you're going to see a real explosion of information. And then maybe we can have an episode in 10 years.
Maybe.
On where we've come with fat
It'll
grafting.
be like episode 500.
Nils will be in the nursing home by that point with a cane. He'll be cranky. You have to do the episode. You have to film the episode from 11 to 1 because he has to take his nap at 2 o'clock.
Dinner's at 2.
Oh, dinner's at 3.
Yeah.
So.
I love this question, blah, blah, blah. And I really would like to dig more. I mean, we did an episode about fasting, but I'm very intrigued by the physiologic components of fasting in relation to wound healing and tissue healing. I mean, like Dr. Warren said, you don't want to stress your body out, and fasting is absolutely a stressor. And that's why I would say you want to know how your body responds to any of these things you're going to do around the time of surgery, well before the time of surgery.
But if it was controlled, like the fasting mimicking thing,
yes,
then maybe, again, we're not recommending this.
I'd still want people to do that at least 2 or 3 times.
Just talk to your
prior.
doctor. There's no fasting before surgery. Yeah. You're not going to say, I heard it on Beauty and the Surgeon.
Right.
But if we're talking theoretically speaking, if you had a fasting mimicking diet, there's so many things, like even ketosis and how that affects wound healing and all this kind of stuff. So you would have to look at it in that sense, but I think there's definitely potential there. I think that's a really, really interesting question. Switching from mTOR to the kind of autophagy cycles and then getting the fat grafting, how does that allow for, so you cleaned everything out and then you start putting back in those building blocks, all of a sudden it wants to build and the fat's there, and angiogenesis, and it's very interesting.
Right. But then you think what is the time frame of coming out of that? Do you need to continue to fast for several days after?
Mm-hmm.
And how should you refeed?
I would love to know what the effect of fasting is on post anesthesia. Remember, we presented this recently.
Yes.
We did things we're into, or studies, science we're into, and I presented that study about post cognitive problems with anesthesia. I would put money on it that fasting before surgery would lessen those issues with anesthesia.
Well, yeah, because you're cleaning up, you're giving your brain a break.
Right.
And that, again, goes right back to blood sugar regulation.
Just say the system you love.
The glymphatic system.
There you go. You said it. Every episode.
Love it. Get in some microglia in every episode. But that's
microglia and glymphatic system.
That to me is one of the huge benefits.
I feel like you sign
fasting.
checks that way.
Yep. Oh, who uses a check? They wouldn't even know whether if it had my name or
that's
glymphatic system.
Elder abuse.
Yeah. But that, to me, that's where the beauty of fasting really comes in, is that it does give your body's systems a chance to really clean house. I mean, for me, the most powerful benefit I see of fasting, which is always so fascinating to me, and the more I fast, the more I feel like my body understands how to fast, is how quickly my HRV goes up and my resting heart rate goes down. And the last time I fasted, my resting heart rate on day 2 of my fast was 38.
Yeah, I was going to say 40. I remember you telling me
38, and my HRV is 112.
Right, which is great.
Yes, which is very good.
People don't understand a high HRV and low resting heart rate. It's good unless you have bradycardia from an arrhythmia.
Right, and that might be too low for some people.
Right.
My heart rate tends to run. I mean, I average.
What is your average at nighttime?
Usually 45 to 48.
See, I'm 48 to 50 usually.
Yep, and my HRV though is usually 70.
Mm-hmm.
So seeing it well over 100 and see my heart rate go, much lower, and it happens quicker each time I fast.
Right.
So I know that my body is responding to that fast in a very positive way for me. That's why I would highly recommend that anybody who's wanting to use fasting for any purpose gets an understanding of how that affects their body, so that they know when to do it. Even for women who are menstruating, maybe fasting the week of your period is not good for you. Maybe it is. There's a lot to have, that this giving your body the best chance of success on your fast, I think, is really important.
I agree.
And I love the glymphatic system.
Yeah, we know that.
Yes. All right. Well, that was it for this round
is
of
beauty
listener
in
questions.
The lymphatic system.
Beauty in the microglia.
Oh, we have to change this.
Right? So when I sent this over to Sarah, I put more questions from listeners. So we love your questions. Please keep them coming.
I like the voicemails. I want some more audio clips.
Well, I've been trying not to beg for voicemails as
You
much
gotta get
anymore,
back
which made me
to
feel
it.
bad about it.
You got to get back to it.
So if you would like to leave us a voicemail or send us a text, you can do that at 303-630-9038. You can find us on all social media platforms at Beauty and the Surgeon Podcast and at Jason Martin MD on YouTube and everywhere else. Dr. Martin, you got to wrap up?
No, I just love all these questions. I think so. Each of them was really interesting, and it just shows you about the field we're in. It's full of unknowns and question marks,
Mm-hmm.
and getting that information is truly empowering for everyone involved. Like even the question on the brow lift, who was that? From Suzette.
Mm-hmm.
From the brow lift and the blepharoplasty is really hitting on a point that's so important. Do you have a surgeon that you trust? Are they going to do the right thing?
Mm-hmm.
Do you have someone who's willing to pivot when they need to pivot and do something different? So these are really, really good points, and I think would be empowering for anyone considering cosmetic surgery. More importantly, though, this episode was empowering and related in relationship to health in your life. And I mean, just the fact that we're talking about something that Amy and I that's all we talk about these days, it seems like, is
fasting.
I think that we're slowly becoming a fasting office as opposed to a plastic surgery office, but I love it. So thank you for all the questions.
Awesome. Thank you, everyone. We'll see you next time.
See you next time.
Don't forget to check out our sponsor, Let's Get Checked. Let's Get Checked offers fast, affordable, and completely confidential health testing for everything from STDs, male and female hormones, and even COVID-19, right from the comfort of your own home. And remember, new customers and listeners of our podcast get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com/beauty and use the code BEAUTY20, beauty, BEATUY 20 at checkout. Get checked. It's the right thing to do.